Hello everyone. So in this video I want to talk to you about how can you get a second opinion in your room from another dentist in the same practice. So this probably more will suit more new graduate on their first year of practicing dentistry, and a situation where they need another dentist to come into the room to provide them with a second opinion. First, for credibility, my name is Khaled. I have been a dentist for 20 years. I own and run my own dental practice, Lakeside Dental Spa in Harvey Bay in Queensland, and I took it from 1 chair to 10 chairs, and from staff members of total of 3 staff members to nearly 40 staff members. You can check my details below. So I believe patients on the chair don't like the idea if you are a dentist and you're getting a second opinion from another dentist. Although this is really important to get a second opinion, I recommend you getting second opinion, and it's very important that you do that. But patients don't see it the same way. Sometimes they see it as maybe you're not competent enough. Why you have to get another dentist to have a look and check things for you, or provide you with a second opinion as well. They feel if you don't have the experience to know what to do, why you're treating me. Although it's normal in any medical or dental field to get second opinions, but as you get it with experience, you probably don't get as much second opinions anymore. So my advice to you, and I've witnessed that before, if you're in a situation where you're bringing other dentists into your room and you're discussing the case with the patient, let's say you are treating a patient, a single tooth treatment, cavity is very deep, very close to the bone or the gum margin, and you are not sure if it's restorable or not, because you still, although you have the clinical knowledge, but you haven't gained the clinical experience yet to make that call, for example, and you're doubting your decision and you want to get another opinion from another dentist. So what happens? You ask your dental assistant to bring the other dentist into your chair. The other experienced dentist will come into your room. Good morning, Mrs. Jones. Dr. XYZ will have a look, and then you will start discussing the case in front of the patient. Oh, I think it's restorable, or maybe do a little bit here, a little bit there, or I don't think it's restorable, or why not? So, and you're having a discussion about the case in front of the patient. From a patient point of view, sitting on the chair and listening to all of that, your trust will drop immediately. A high chance with the minimal, smallest complication, this patient will eventually complain or put a bad review on your service and might even request not to see you again. So how we should be doing that? My advice to you is to keep everything private as much as possible away from the patient. So if I was in your position, I would take some good photos, x-rays if needed as usual. I will step outside the room myself. I will ask for the other dentist privately to have a look with me on a screen completely outside the room. Have the whole discussion completely outside the room, and then most time with good clinical photos and good clinical radiographs, you don't have the other dentist to come into the room to check the teeth for you. Even now we have scanners where you can scan the teeth and basically have like a real view of the mouth outside the mouth. Get all the opinions you need, and then go back to the patient and complete the treatment. You don't have to tell your patient get a second opinion, of course. You can let them know, have a break, I'm just gonna go and check something and come back to you again. If it's a big case, let's say it's a complex treatment, requires a lot of orthodontics, implants, or full mouth rehab, and you need another dentist to give you an opinion or take over, that's okay. I think that's normal because they want to physically check the patient. And that's when I will tell my patient, look, your case is quite complex, and the way we work here, we like to get opinions from each other. We have different clinicians with different level of experiences. So I can give you the best service and I can give you the best opinion. Would you mind if I call Dr. XYZ? He or she, they are very experienced in that type of dentistry. So I want them to be in the room to have a look in your mouth as well and provide another opinion. Would be okay with you to do that? Usually patients are fine with that. But when it comes to like single tooth treatments, just be very cautious when you bring another dentist in your room, and try to keep this conversation privately. This will minimize the risk of complaints, will minimize the risk of the patient mistrusting or their confidence in you dropping, and of course it will benefit the patient as well. You don't want a patient who's sitting on the chair a bit anxious about your confidence or your skills. You want them to be comfortable with your dentistry, and the more the patient is comfortable, the more you'll be comfortable, and you will treat your patient to the best abilities and give them the best service possible. If you find this information helpful, make sure you like it and share it. If you subscribe to my channel, you'll be notified with more videos when I release them. Thank you so much for listening. It means a lot to me.